Okay, looks like it's 1:30. So we'll probably have a few folks who will keep joining. We'll give it about another 30 seconds, and then Caitlin, I'll pass it to you to get us started. Okay, let's go ahead and get started.
Great. Hi, everybody. Welcome to our Climate and Health 101 webinar. Thanks so much for joining us today. My name is Caitlin McLaren. I am a nurse and I coordinate the Climate Committee of SEIU Local 1991, which is the Union of Healthcare Workers at Jackson. And we're really excited to be partnering with Florida Clinicians for Climate Action, as well as ANHE and Healthcare Without Harm to put on today's presentation. So just a couple housekeeping items. We are going to go through the presentation and then have questions at the end. So if you do have questions that you want to ask, feel free to put them in the chat or just make a mental note to ask them at the end of the presentation. And please keep yourselves on mute so that people can hear the presenters and we don't get background noise. And we are recording, just so everybody knows, so that folks who missed it or come in late can catch up and watch the whole presentation. So thanks again, everybody, so much for joining us. And I'm going to hand it over to Melissa.
Wonderful. Thank you so much for joining us for this today. Caitlin, we're so pleased to be able to partner with you and SEIU, as well as our wonderful partners, the Alliance of Nurses for Healthy Environment. So thank you all for being here today. My name is Melissa Baldwin, and I am the Program Manager for Florida Clinicians for Climate Action. Next slide. So at Florida Clinicians for Climate Action, we're basically a group of health professionals, including doctors, nurses, and medical students who are concerned about the impacts of climate change in Florida. And what we do at FCCA is we engage health professionals to learn about the health harms of climate change and then to advocate for equitable policies. So speaking of learning, that's what you're here to do today. So you're already getting engaged and we're happy to have you. So let's have the next slide and we'll talk about our learning objectives for today. This will be available for a 1 CE credit for nurses only, and the learning objectives are as follows. We want you to be able to describe at least 3 ways that climate change affects public health. We want you to be able to explain at least 2 types of populations who are vulnerable. And finally, we want you to be able to identify 3 different actions that healthcare providers can take to advocate for solutions. So let's go ahead and move on to the next slide. This is that classic slide that you've probably seen before that explains the greenhouse effect. So you've probably heard about the greenhouse effect. Essentially, what happens is that when the sun's rays hit the earth, some of that heat radiates and bounces back off to space, and some of that heat is trapped in our atmosphere. It's actually a good thing that we have the greenhouse effect because it keeps us warm at night, so it's not freezing when the sun goes down. Think about it like a blanket. However, with man-made climate change, we put too much heat-trapping pollution into our atmosphere. So think about it like our pollution blanket is getting too thick and it's trapping too much heat and heating up the planet. Next slide. So where is the pollution coming from? Well, we know that we burn gasoline in our cars and we burn coal and oil in our power plants to make electricity. Primarily, the pollution is from fossil fuels. Fossil fuels are called fossil fuels because they're actually made from fossils. Oil, coal, and gas were created millions of years ago, and they're basically ancient plants and animals that were built over time. And over time, these plants and animals were buried and condensed, and they formed into coal and oil that we use today. So humans extract that energy and we burn it in our factories and in our vehicles. So we're taking this energy that took millions of years to create, and we're shooting it up into the atmosphere. So there are consequences to that because we're upsetting the natural balance of carbon in our system. Next slide. So some people say that climate change is just a natural cycle. That's not true, and I can explain to you why. Let's look at this graph. I promise I'll only show you 2 graphs today. So if you take a look at this graph, this is a record of global temperatures going back to 1900. So the green line is what accounts for natural factors. That's things like the elliptical orbit of the Earth around the sun. Scientists can understand natural cycles and we can measure them and we can account for them. So if you look at the natural cycles only, the green line, you can see that it does not line up with the black line, which is the observed and measured temperatures. The blue line accounts for both human activities, humans burning fossil fuels and releasing carbon and other greenhouse gases into the atmosphere, and for the natural factors. And so you can see for yourself that the only thing that accounts for the warming that we've observed is when we account for the man-made emissions. But you don't have to take my word for it. I encourage you to listen to the scientists. 97% of climate scientists agree that the Earth is warming and mankind is primarily responsible. And that's based on peer-reviewed literature. Next slide. Okay, so this is my last graph, and it looks complicated, but I'm going to explain it. And the most important thing I want you to take away from this graph is that our carbon pollution right now is outside of the normal safe range. So if you look at the horizontal axis, that's time. That goes back over 800,000 years. On the vertical y-axis, you have parts per million of carbon dioxide. That's the measurement of how much carbon dioxide we have in our atmosphere. Scientists can measure this using historic records like tree rings and ice core samples. And so one important thing I want you to think about is that human civilization has really developed as we know it over the last 10,000 years or so. So if you look back over 800,000 years and think that we've really only had civilizations as we know it for 10,000 years, the important thing to think about is that during all of that time, if you look at that graph, carbon dioxide concentrations have always stayed within a safe limit. They've stayed between 180 parts per million and 280 parts per million. And right now, today, we're over 400 parts per million. So we're nearly double the safe historic levels of carbon dioxide that we've had in our atmosphere. And there's going to be consequences from that. So scientists tell us that if we want to avoid the worst consequences, which would mean an uninhabitable Earth where we have melting polar ice caps, sea level rise, we've really got to get our carbon levels down to about 350 parts per million. So 350 parts per million is the scientific prescription for what we need to achieve to have a livable, safe planet. And it's important to point out too, and I think Carol will talk more about this, that we've already warmed a little over 1 degree Celsius, which is about 1.8 degrees Fahrenheit. So if we don't reduce pollution, if we keep going as we are going, if we don't do anything to address this problem, we could see warming of up to 4.0 degrees Celsius. So 4 degrees might not seem like that much, but think about it like you think about a fever. If you have a person who's presenting with a low-grade fever, say they have 99-degree fever, and you add 4 degrees, that gets them up to 104 degrees. And so that's dangerous. Systems can start to shut down. Our bodies can't function properly when they're overheated, and neither can the planet. And now I'd like to pass it to my colleague, Carol Lindsay, who's going to talk to you more about the ways that climate change is affecting our health.
Yes, hi. My name is Carol Lindsay, and I'm a retired family nurse practitioner. I'm also a member of the Florida Clinicians for Climate Action Steering Committee member. I'm a member of the Alliance of Nurses for Healthy Environments, ANHE, and I'm also a member of the CLEO Institute, which is also an environmental nonprofit organization in Miami, Florida. So today I'm going to talk to you about climate change and its impact on health. And while I'm talking to you, I want you to keep in mind that I'm just explaining some brief things about climate change. There's a lot of things, so I encourage you to research it more. You can Google the information, especially that's pertinent to you and that's interesting to you. And also I want you to think about how what I'm explaining to you can affect yourself, your family, your community, and also the patients that you take care of. And I thank you all for your attention today also. Next slide. So again, I'm a member of the Alliance of Nurses for Healthy Environments, and it's free to join to get on their newsletter. And their aim is to inspire other nurses to help their patients and communities and other healthcare institutions to engage in climate change mitigation activities, and also to prepare for the potential effects of climate change. Even if you're not a nurse, you can go on their website, you can Google them, and they have a lot of wonderful resources and information there. Next slide. So this is a slide from the CDC, and this circle that's going around in the middle, these are the most significant climate change impacts. And we're talking about increasing carbon dioxide level, which Melissa spoke to you about. This leads to rising temperatures, more extreme weather, and increasing sea levels. The next circle are the effects of the climate change, the impacts, which leads to severe weather, air pollution, changes in vector ecology, increasing allergens, water quality impacts, water and food supply impacts, environmental degradation, and extreme heat. And then outside of this circle, these are the health impacts, which I'm going to be going over a few today. For example, with severe weather, hurricanes, flooding can lead to injuries, fatality, mental health impacts. And we'll go over in more detail in the next slides. Next slide. So we're all going to be affected by climate change, but there are certain vulnerable populations that are more affected. And these are probably people that you see at the hospital that you work at. You probably see low income persons coming in for care, communities of color, children, the elderly, well, we live in Florida, and those with limited language proficiency. These are some of the most vulnerable populations. Next slide. And we're going to talk about extreme heat. Now, we live in Florida, so we all can really identify with this. And with climate change, we're going to see higher temperatures. We're already seeing these. Higher heat, increased humidity, longer and more frequent heat waves. And these can lead to health problems like dehydration and heat stroke. And some populations are more vulnerable than others. And I'll be speaking about them. Next slide. So just to emphasize again, we've had the 10 hottest years on record globally. 2016 was the hottest year on record since 1880. And 2019 is the second, and they think 2020 might even be hotter than 2019 was. Next slide. And specifically for Florida, Florida in this March 2020, it was hotter. It was the hottest March on record in 126 years, according to NOAA. So temperatures are definitely increasing globally and also in our state. Next slide. Now, you all might be familiar with the heat index, where we have the actual temperature, which is the right upper part of the screen, and the humidity factored in the left lower part. Both of these lead to the heat index. For example, Fort Lauderdale at 95 degrees on this particular day, when you have relative humidity, it gives you a feeling like it's 104 degrees outside. So it's feeling hotter and hotter because of humidity also. Next slide. So there are heat-related illnesses as a result of all this heat. There's medical conditions that may occur or can be made worse as a result of heat exposure. And extreme heat can cause a new onset of these issues, and it can also cause severe dehydration. Extreme heat is also very, very dangerous because it increases pollution for ground level ozone and particulate matter, which can worsen existing cardiovascular disease and respiratory disease. Extreme heat can cause cardiac stress, our heart's working harder. This can aggravate previously diagnosed problems that can create new ones. It can cause chest pain. It's been associated with more incident of stroke, mental illnesses. They found that that increases the incidence of violence, aggression, and suicide. You know, you can get hot-headed the hotter it gets. It can also lead to kidney disease from being dehydrated, and also with that ground ozone, like people that are working in agriculture, if there's fertilizer on the ground, they may be inhaling this, and this has been associated with kidney disease. Next slide. So there are some populations that are more at risk from extreme heat. Older adults, because they don't thermal regulate as adequately as when they're younger. They often have pre-existing conditions which make them more at risk for heat-related illnesses. Children, people with pre-existing problems like obesity, cardiac issues, high blood pressure, lung and heart disease, diabetes, kidney disease. All of these make them more at risk for heat-related illnesses. It's a harder stress on their body. Some medications even hamper thermal regulations. People who live alone or have physical disabilities, maybe they don't have air conditioning, they can't get out to areas where they can get cooled off. And also in this time of COVID, it's more difficult to get around. Pregnant women, if you work with pregnant women, they're at more risk for preterm birth and delivering low birth weight babies during extreme heat. And these are the two leading causes of infant mortality. People with mental illness, they have triple the risk of death due to heat stroke, especially people with dementia, mood disorders, schizophrenia. This has all been proven by studies. People that are homeless, working outside, exposed to extreme heat for longer periods of time. Athletes, I don't know if you heard about this high school football player in Lee County. He was out exercising in 90-degree heat and he ended up dying from heat-related illness. There's also heat-related deaths are 2.5 times more likely in African Americans than non-Hispanic whites, and that's primarily due to higher rates of underlying diseases and also maybe lack of air conditioning. And there's a common denominator too between extreme heat and the coronavirus. Many of the same vulnerable populations are more severely impacted by the coronavirus. Next slide. Now, I'm a retired nurse practitioner, so I'm not seeing patients anymore, but a good friend of mine, Dr. Cheryl Holder, she told me about her patient named Jorge. He lives in Little Haiti. He sells fruit on the side, so if he doesn't work, he doesn't get paid. He has cancer. He also has diabetes, and his condition is deteriorating. He lives in this tiny shack, which you see in this picture. There's no windows. He doesn't have air conditioning. He is a vulnerable patient. Just think about it. He's elderly. He has comorbidities of diabetes and cancer. He lives paycheck to paycheck. If he doesn't work, he doesn't get paid. And he lives in this little tiny house where there's no air conditioning or heat. This is the type of person that is considered more vulnerable to heat-related illnesses. Next slide. Now we're going to pop over to extreme weather, which again, being Floridians, we're very familiar with. We're experiencing more increased frequency and severity of heavy downpours. Increased precipitation from the heat from the ocean causes more rain, which leads to more flooding. Out west, they have more droughts, and there's more major storms, more severe hurricanes that are happening. This results in injury, illness, displacement, and death, and this affects certain populations more than others. Next slide. And I don't know if you were aware, but on May 26th, Tropical Storm Bertha of this year, it dumped more than 14 inches in Miami in 72 hours. And these are becoming more and more common things that are happening. You may live in a flood zone in Miami, and this is partially due to climate change also. And you know, it can lead to hurting your cars and property damage. Next slide. And then we have more severe flooding also, and we have melting of the polar ice. This is increasing flooding. We have these glaciers that are melting faster than they have in past history because it's warming up our planet. Next slide. We also have more severe storms, as you know, right now. As far as hurricanes, we're onto the Greek. They're naming hurricanes because of by the Greek names, because we've gone through so many severe storms already. You remember Hurricane Maria, it hit Puerto Rico back in 2017. 100% of the electricity was cut off on that island. This is a Category 5 storm. Hurricane Michael hit northern Florida a couple of years ago, and they're being hit again. So we're seeing more severe storms, more Category 4 and 5s, and more frequent storms as a result of climate change. Next slide. And then another effect of climate change is air pollution, and this is from wildfires, which we don't experience too much in Florida. Smog, pollen, and mold, these are all considered a type of air pollution, and these can exacerbate asthma and lead to allergy attacks, and some populations are more vulnerable. People with heart and respiratory conditions already, heart disease, asthma, or COPD, chronic lung diseases. Next slide. And like Melissa was talking about before, we have fossil fuel pollution, and this affects air quality. Air quality is so important, as you know, and air pollution impacts the quality that comes from different sources, such as burning of fossil fuels, fuel oil, things to make single-use plastic, making styrofoam. But what happens is when the air pollution is released into the air, it releases a mixture of small particles and also droplets. And these come in various particular sizes. And when we inhale these, sometimes we're able to cough them or sneeze them out. But if they're too small, then we inhale them deep into our lungs. They can irritate our lungs, cause respiratory problems, lead to cardiovascular problems, and even lead to cancer if they're absorbed into our system. Next slide. And you probably saw the Harvard research earlier this year that showed that there's a higher fatality for coronavirus death rates that's linked to air pollution. They found that if there's an increase of particulate matter, which I just spoke about at 2.5 micrograms, it's associated with an 8% increase in COVID-19 death rates. So air pollution is also terrible for diseases such as COVID. Next slide. And then we have the effects of sugarcane burning. It's more in Okeechobee, Central Florida, but you may care for patients in the hospital. This can lead to respiratory diseases. It has carcinogens. When it's released, they call it black snow up in that area. It can cause liver and kidney damage and increased risk to skin, lung, bladder, and GI cancer. And the Florida Clinicians for Climate Action, we're working with the Sierra Club to see if we can convince the sugar industry to switch to something called green health burning and green harvesting, which won't have the effects of releasing this type of air pollution. Next slide. And more carbon dioxide releases more pollen. Some trees just love it when there's more carbon dioxide. Like this slide illustrates, if we have 400 parts per million of carbon dioxide, you're releasing 7 million grains of pollen. But if that goes up to 600 parts per million, it releases double that, 15 million grains of pollen, which can lead to increased respiratory problems, including allergy, exacerbation of asthma. It can lead to more molds. So this is definitely a problem with climate change. Next slide. And then because it's getting warmer and warmer, we have an increase in mosquitoes and ticks. And you know, mosquitoes, they can lead to diseases like West Nile virus, chikungunya. We had Zika in South Florida a couple of years ago. In 2004, as this illustrates, we had less than 200 diseases caused by mosquito-borne and tick-borne diseases. But then in 2016, it went up to over 1,200 mosquito-borne and over 200 in tick-borne. And mosquitoes love it when it's hot. It increases their metabolism, they get hungrier, they bite more, their eggs hatch faster. And because it's staying warm longer, we have more mosquitoes and more ticks being born. And because it's getting warmer in areas that weren't warm before, they're expanding their geographic area. So we'll probably see more diseases in the future. Next slide. And then we have waterborne diseases because temperature and precipitation, we have more rain. This affects the water quality also. We have more runoff from farm and livestock. We have runoff of fertilizer. Maybe you saw a couple of weeks ago in Key Biscayne where we had some fish kill. They think that that was from fertilizer runoff into the water and also from warmer waters. There were fish and rays that were gasping for air. It's affecting Biscayne Bay. It's affecting our waterways. And what happens when we have this kind of maybe sometimes algae blooms, harmful algal blooms that get into the water, people can get sick from ingesting the water, drinking it, from inhalation, direct contact with contaminated water, and it can lead to waterborne diseases caused by pathogens such as bacteria, viruses, and protozoa. Next slide. And again, blue-green algae and red tide, these are problems more in Western Florida, but with warm water, increased nutrients from fertilizer and other runoff, certain algae can grow very quickly and overpopulate. And some of these blooms release toxins that make ecosystems and animals and humans sicker. And scientists call these harmful algal blooms. And this affects the shellfish industry and the fishing industry for in Florida when these are contaminated with this blue-green algae. Next slide. And then we have contaminated food. When it warms up, when we lose electricity, the food can get contaminated. It's not at the right temperature. Things that are stored that will grow the corn, other things that are produced in Florida with the increased humidity, the heat, all kinds of bacteria and toxin can grow in this food as a result. Next slide. And then mental health problems, stress, depression, anxiety, post-traumatic stress disorder, suicidal thoughts. Just think of it, and maybe some of you went through it. If you lost your house or it was damaged because of a hurricane, you can't get to work, you can't get to your medical provider, you can't pick up your medications because we have a hurricane going on. So we can't get out. So people get very depressed, suicidal thoughts, and also when it gets hotter, all type of mental health problems can result. Next slide. And like this slide shows, you know, higher temperatures increase suicide rates in the United States and Mexico. People whose livelihood depends on maybe fish and shellfish, and they can't fish for these things, or they can't get to work. All of these types of things can lead to mental health issues. Next slide. And then this is just a really easy way to remember about climate change. Heat wave. You're gonna have a heat wave for those people that remember that song. H stands for heat illness. Heat illness can cause dehydration and other issues, cardiovascular problems. E exacerbates heart and lung conditions that can be from the heat, asthma from increased pollen, traumatic injury, the T from hurricanes, severe thunderstorms, people out there trying to fix their house after a storm, water and foodborne illnesses from contaminated water, from runoff, from harmful algae blooms, allergies from increased pollen, vector-borne diseases from increased incidence of mosquitoes and ticks, emotional stress as a result of these severe thunderstorms and the heat, you know, all of these things. Just remember heat wave. It's a very easy way to remember. Next slide. But you have the power. You know, all things aren't dismal. There is the possibility to make some changes, but it's important to understand why. Next slide. So you can join, if you're a nurse, you can join the Alliance of Nurses for Healthy Environment. You can be proactive. You can join Florida Clinicians for Climate Action. Next slide. If you're a nurse, you can join something called Nurses Drawdown. If you're not a nurse, you can join Project Drawdown. And what this is the commitment of nurses globally to improve the health of individuals and communities while also taking steps to heal the planet. It's a brand new program, just happened this year, the Nurses Drawdown. Next slide. And nurses are invited to take action. They're focusing on 5 key areas: food, switching, committing to a more plant-based diet, like Melissa said, with producing meat that releases methane when they poop. The methane is a greenhouse gas that's released. It takes a lot of land to produce meat. You can eat it maybe once a week. Instead, clean cook stoves, reduce food waste. Americans waste so much food. Just think twice about when you're buying food. Do you need all this food? Mobility, switching to biking, using mass transit in non-COVID times or carefully during COVID times, more walkable cities. Gender equity, again, for globally educating girls, family planning, energy, supporting clean energy in the future by promoting energy efficiency, advocating for transition to renewable energy. Nature-based solutions, planting trees, protecting tropical forests and other forest protection, because forests and trees absorb carbon dioxide. So that's something about climate change and its health impacts in a nutshell. Please feel free to contact me for more information or Google. I'm going to turn it over to Melissa, and she'll be talking to you more about what health professionals can do to make a difference. You go, Melissa.
Thank you so much, Carol. Fantastic presentation. Next slide. So Carol was right when she said you have the power. You might not know this, but the most trusted professionals in America, the top 3 are all health professionals. So people trust nurses and healthcare workers more. Not everyone knows a climate scientist, but everyone knows a nurse or a physician or a healthcare worker. And health is really the most convincing way for us to engage people in this conversation and to help them realize that climate change isn't a faraway problem, that is a problem that's affecting us now through our health. So next slide. So there's 3 ways that we want you to get involved. There's 3 different ways to think about it. When we say engage, you're already doing that right now. You're showing up here for this conversation. We want to thank you for doing that. We want you to join a group, get involved, sign up for newsletters and updates. You're already doing that. So thank you for doing that. That is the first step to taking meaningful action. The next step is to educate, just learn about climate, enhance your climate literacy, listen to talks like this, do the research online, find the thing that you're really interested in and learn more about it. And please let us be a resource to you as well as our partners, because we have stacks of videos and all kinds of educational resources to support you. And finally, the third thing we want you to do is advocate, right? So we know that health professionals are trusted. And so that really put you in a position to make a real difference, because lawmakers are more likely to listen to you, patients are more likely to listen to you, and so you have real power in using your voice to advocate for policies, and not just any policies, but policies that have equity at their core, and that take justice issues into account. So next slide. So I hope that you will consider joining Florida Clinicians for Climate Action. It is free. If you have a smartphone right now, you can just hold your phone up to the screen, up to that QR code, and that'll send you right to our website where you can sign up for our newsletter. We are all about climate solutions, because climate solutions are health solutions. So when we are addressing this problem, we also have the opportunity to address so many other challenges: air pollutions, death, air pollutions, cancer, obesity. There's just so many problems that are interrelated here, and where for many of them, developing climate solutions is not only going to help us by giving us a planet that we can continue to live on, but also it's going to improve our health outcomes. So we want to thank you for that. And I want to go ahead and pass it back to Caitlin, who's going to tell you now more about what your union is doing and how you can get involved with that work.
Thank you. Thank you so much, Melissa and Carol, for your presentations. That was really excellent. So yeah, so I want to talk a little bit about SEIU and what's happening nationally and locally. Why should workers and unions care about these issues, and what can we do about it? So for those who don't know, SEIU, Service Employees International Union, is a labor union with about 2 million members in the United States, Canada, Puerto Rico, and representing a really wide array of job classes. So there are healthcare workers like us at Jackson. There are, building cleaners, janitors, airport workers, public sector workers, all kinds of people around the country and in North America. And so a few years ago in 2016, SEIU passed a resolution at its convention calling for environmental justice for working people, and calling on the union to focus on climate action with a racial justice and economic justice lens, because as Carol just talked about, a lot of the people who are going to be the most directly impacted by climate change are low-income people, working people, and people in unions. That's I guess our base, and our families and friends and people that we know are going to be affected, and our patients as well. So SEIU has endorsed the Green New Deal, which is a suite of policy proposals that basically calls for massive investments in green technologies, green jobs, and basically a move towards a green economy. We also were a founder of the People's Climate Movement, which has mobilized people in climate actions all over the country, and also was a co-founding organization of the Blue-Green Alliance, which is an alliance between unions and environmental organizations calling for worker-friendly climate legislation. Additionally, SEIU is involved in education and training of members. So for example, there's the Certified Green Janitors Program, which has trained thousands of building cleaners in green cleaning and efficient methods. So that's sort of a a quick synopsis of what's going on the national level. And then locally at Jackson, a few months ago, some of you who are on this call and others got together and said, we really, as healthcare workers in Miami, which is, really ground zero in some ways for climate change, we really want to do something about this. And we know that this is going to affect us and it's going to affect our patients. And so we formed the climate committee, and we brought this to Jackson's leadership, and they said, we're interested, we'd love to partner on this. And so we've been meeting for the last few months and working on a few different things. One thing is education, just involving and educating more staff at Jackson about what are the effects of climate change, how does it affect health, how does it affect our patients. And so this webinar is part of that. Additionally, we've started a green tips section of not only Jackson's newsletter, The Insider, but also the union's newsletter, where we share things that people can do on an individual level to reduce your carbon footprint, like swapping out, plastic water bottles for reusable, things like that. And also we've been advocating for best practices. So we've been researching what are things that Jackson can do, because we know that our purchasing power as a large institution is really greater than what each of us can do individually. And one of the things that we've been focusing on and asking for is to stop using styrofoam in the cafeteria. And we heard that they are planning on phasing it out this month. So that's something that we're really excited about and looking forward to. And also just trying to get people more involved at Jackson in the existing programs that we have, like the Stryker Medical Waste Recycling Program, which exists, but a lot of people don't know about, where you can actually recycle things like pulse ox probes and SCD sleeves. Rather than throwing them away, we can actually give it back to a company that will reprocess it and sell it back to us, so we're not putting everything in a landfill. So there's a lot that we can do at Jackson as healthcare workers to move our institution in a greener direction and involve more of our coworkers, hopefully, in these organizations that Melissa and Carol talked about, so that each of us can become an effective advocate for change. And one of the things that our committee has been discussing that we're really interested in is getting Jackson involved in practice green health. And our next presenter is going to talk a little bit more about what that is. So I'm going to hand it over to Shanda.
Terrific. Thank you so much, Caitlin. Does everyone have volume on me? All right, perfect. And I am comfortable with just giving the cue to go ahead for each new slide, if that's okay. And I see you're on the front one here, so that's terrific. Well, thank you so much to SEIU 1991 and, of course, the Florida Clinicians for Climate Action for inviting me to hop on the line today and talk about practice green health and more broadly, environmental sustainability and healthcare. Before I get going, I'll just do a quick intro of myself. So I'm a nurse by background. I worked as a cardiac telemetry nurse in Minneapolis for about 7 years before transitioning to my current role as something called a member engagement manager with Practice Green Health. And basically this is a dream job. I get to, and I say that truthfully, a lot of people will just mention, oh, it's a dream job. This is really a dream job. So I work with hospitals and health systems, primarily in the northeastern part of the US, but also the Midwest, around all things environmental sustainability, all things climate action. And so I have basically about 150 hospitals who are kind of like my patients. And we get to do assessments of their sustainability initiatives, plan together for how to address sustainability and climate smart healthcare. And then we have a pretty detailed sort of benchmarking and data collection process around that too. So let's hop to the next slide. I heard a little bit about some of the terrific work already that you're doing within Jackson, and there are also a lot of other hospitals within Florida that are doing some comparable work along the lines of sustainability. And Practice Green Health more broadly is a national nonprofit that basically it's a membership organization. So hospitals work with folks like myself for this technical expertise in the realm of sustainability. And I pulled some of the, well, actually all of the Florida hospitals that are Practice Green Health members. And there's a link, I'm sure you'll get these slides after, but there's a link to our Practice Green Health website there. And you can see that there are over 60 hospitals, some in your neck of the woods, but across the state that are deliberately connecting with us to be more environmentally sustainable. And some hospitals will be just a kind of a one-off, you know, one of a part of their systems, and other hospitals systems like you see HCA, a lot of their facilities work with us. Let's hop to the next slide. And so I heard you talk about some examples, Caitlin, of environmental sustainability around waste, pharmaceuticals, reprocessing, all of which is really, really important and foundational of this sustainability work we do. And I know Carol Lindsay prior had talked a lot about climate change and the health impacts for Floridians as well. And sometimes there's a little bit of a misunderstanding between what's climate change, what's sustainability, what's planetary health, what's global warming, all of this somewhat seeming jargon. And so when we use the term environmental sustainability, I also like to share this Venn diagram of basically this people, planet, and of course, profit angle as well. It helps folks sort of understand all of the aspects of sustainability proper that can be beneficial for a hospital or a health system. And when we talk about it, it's really important that we're able to look at sustainability and just environmentalism more broadly from this sort of triple lens of people coming first. That's why we're nurses. That's why we do what we do. And that same sentiment is, probably shared amongst your colleagues throughout the hospital. So, talking about sustainability from that patient safety, patient experience, and more broadly, patient and human health on planet Earth has to come first. And then the planet angle, when we talk about reducing the amount of energy we're using within a hospital, when we talk about reducing the amount of waste or the chemicals that we use, or our impact on the food, industrial, agricultural system from a waste perspective, what does that actually mean for the planet more broadly? Clean air, water, et cetera. And there's a profit angle to this as well. And I'll show you a slide in a couple minutes about some of the specific metrics that can be useful when talking to leadership about the value of sustainability. Because of the healthcare sort of tertiary structure we have in the United States, we know healthcare is a business right now. That is the way it is, and that's the way that we operate as direct care professionals within that system. And so when we are pitching these ideas to leaders, it's also valuable to understand what they're sort of accountable for, and oftentimes that has to do with the bottom line. Let's take a peek at the next slide. Thank you. So this is a snip basically just of our homepage at Practice Green Health. And you see the little icons on the bottom, which are representative of all of the focal areas that we work with hospitals on in terms of environmental sustainability. And some of the typical ones that you would expect, we've already mentioned energy, waste, et cetera. We also work really closely with healthcare to help them have an environmental check on their supply chain. Believe it or not, so much of the emissions, the greenhouse gas emissions produced within the healthcare sector hail from that supply chain. What are you using at the bedside? Where was it produced? What did it take to make? Does it go in a landfill after you use it? Those syringes, those IV bags, those pharmaceuticals, where does it end up? And what happens to those materials after the point of use? And so thinking about how we can have multiple angles of impact that go far beyond the bedside. At Practice Green Health, we also work with hospitals around a big area of greenhouse gas emissions and inefficiencies, and that's transportation. Just generally in the United States, excuse me, the toss-up between greenhouse gas emissions recently has been between electricity and transportation. And so when we think about transport in the context of a health system, thinking about, well, what sort of non-idle policies do we have in place to prevent that air pollution coming out from even ambulances, for instance? How are employees and patients getting to work or to their clinic appointments? Are we encouraging public transport where it's possible? Do we encourage active transport? Do you have bike racks and showers and safe places for employees to reduce their dependence on fossil fuel transportation? We also have a really big focus on our operating rooms. And so we know that the operating room has some of the highest energy consumption and waste production of an entire hospital. And curiously, anesthetic gases, the use of some of these pharmaceuticals for patient sedation cases, specifically desflurane, if you hail from the OR, the greenhouse gas impact or the global warming potential of desflurane is almost 3,000 times as potent as carbon dioxide. So that's just an example. We do a lot of work in the OR in terms of reducing unnecessary lighting and air exchanges when there's not a patient actually going through a case within the operating room. We talked a little bit about chemicals. We do a lot of work around getting PVC and DEHP, both of which are carcinogenic, teratogenic chemicals that are very commonly used in healthcare plastics. We're talking IV bags, IV tubing, breast pumps, tube feeding pumps, getting those out of healthcare and out of the hands of direct care professionals that don't even know these chemicals are within our products. This kind of gives you an overarching look at what we work at, really helping our hospitals with across the sector. Let's go to the next slide. So I've included a couple images here. This first one you look at is more in the context of climate. And so this gives an idea of how healthcare contributes to climate change. And that might not be something that is front and center as a direct care professional, but by the nature of being a nurse, the way that we do our jobs while taking care of patients inherently requires us to operate within this whole healthcare system that's very dependent upon fossil fuels, which I know, as Carol Lindsay mentioned, is contributing to increased climate change, which has an amalgamation of health impacts for patients and those disproportionately impacted patients as well. So this gives you an idea of, where some of those greenhouse gases are emitted within a hospital. And then if we look at the next slide, this kind of gives an idea, high level, of how health care and nurses can take action. And so we have all sorts of little green clouds here. We talked a little, I heard you mention reducing styrofoam, for instance, or more properly diverting waste, reprocessing materials and recycling them instead of putting them in the landfill. That's terrific. And that's one angle. We also obviously have a footprint when it comes to cafeterias and patient food. Do we have high levels of antibiotics in the meat that we're purchasing, which is contributing to basically increased antibiotic-resistant bacteria and other pathogens? Do we have high amounts of meat that we're serving, which has a greater impact on the agricultural system in terms of energy use, water use, and emissions? Do we buy local? Do we buy sustainable? Do we have, different opportunities to educate patients and colleagues about some of the efforts that you're working on? So I love this slide because it gives everybody an idea of how they can have an impact within their own realm. Take a peek at the next slide. So I mentioned that I'd talk about dollars, and this is really an angle where we share with leaders how the hospitals that work with us have the opportunity to save hundreds and hundreds of thousands of dollars, if not, over $1 million annually from some of these specific initiatives. And so you can see the little icon on the left shows sort of which categorical area those financial savings are within. You see energy, of course, which is a common angle. We see lots of financial savings when it comes to water, waste, etc. And if this is something that Jackson Health would be interested in digging more into, we can certainly provide some more specific specifications. Next slide. And a lot of our systems do participate in something called the Healthcare Climate Challenge, which is just a seed that I wanted to plant, that on top of sustainability, there are also hospitals who really are aiming to reduce their carbon footprint, their greenhouse gas emissions, and actually setting bold carbon reduction and carbon neutrality goals as well. Next slide. And last but not least, I just wanted to introduce another opportunity for nurses to get involved, which is called the Nurses Climate Challenge, and it's linked there. Basically, this is an initiative hosted by Healthcare Without Harm, which is a co-organization of Practice Green Health, and Alliance of Nurses for Healthy Environments, which you've heard about on the line. And we prepare nurses to talk to their colleagues and patients about the health impacts of climate change. And you can see the picture's little, but we have a lot of nurse climate champions in Florida already doing this work. I think that's the last slide from me here. So with that, I'll turn it back to the team for the next part of the conversation.
Wonderful. Thank you so much, Shanda. And thank you, Carol and Caitlin, also for presenting. The next few slides are just some follow-up resources for you all, and we will make this slide deck available to you all as a PDF. So we have a list of advocacy resources. I think the next slide, if you want to go ahead and switch it to the next one, that's our contact information. And then the next one is just an appreciation for all of the different groups. There's really a great set of groups working in Florida on these issues and around the country. So I think we should go ahead and open it up for questions and answers now. If anyone has questions, you can type them into the chat, and or you can unmute yourself and ask a question. Don't see any questions.
Hi, this is Leela Posa. How are you? Thank you so much for doing this. I actually have a question or a comment, and it is, I don't have, I say this because I think that I would like to hear everybody's viewpoint on this, which is that whenever I have tried to say climate change to the wrong people, there's always a very strong reaction. So it's almost a trigger. It's sort of like a word that that has the capacity to generate really negative reactions and responses in people. And most often it's kind of a denial, of climate change and so on and so forth. So I was wondering if there is any consideration on the part of the folks who are interested in actually changing, let's say interested in the new Green Deal, let's put it that way, in kind of like maybe moving away from using the word or the term climate change into, and maybe morphing it to something that we all can agree upon, something like climate crisis or something like that. Because it's almost kind of like the word climate change or the term climate change almost has the same kind of response or reaction like racism. So if you say racism and you hope to have a conversation, it just doesn't happen with the wrong people. Even though I think we can all agree that both climate change and racism really needs a lot of work.
I have some thoughts on that, and I want to open it up to the others. I think to some degree, there's a great resource called the 6 Americas, and it goes through all the different levels of people's awareness and concern about climate. And I think there's a small group of folks out there who, no matter what you say to them, they're not going to get on board. But there's certainly a larger group of people who are in the middle or unsure or just still seeking that information. So those are the folks we want to engage with. And I do think that your point about the words that we use matter, words matter, and the way we talk about it matters. And so maybe my advice would be to start with something that you think they can agree with in a middle ground, and also try to find out what values they have. Maybe they're a person of faith, maybe they're a person suffering from allergies and this allergy season is really bad, but try to meet them where they're at. And also just know there are some people who are never going to get on board, but we don't necessarily need that group of people, because there's enough folks who are in the middle that have room for growth and engagement. And I want to pass it to my other colleagues. I see Shanda and Carol shaking their heads.
Yeah, this is Carol. Yeah, I agree, Layla, and thank you for bringing that up. It's going to be impossible to convince everybody. It has been termed climate change, climate crisis. It has different terms, but even scientists recognize it as climate change. NASA, some of these are national science organizations, and international organizations recognize it. So you can always refer back to those. And I definitely agree with Melissa. You know, when you're talking to people, talking to certain audiences, you try to find out what's important to them. For example, if you're talking to Catholics, you know, Pope Francis has put out a whole book on this and has spoken about it, how important climate change, he calls it climate change, is also. So it's really important to see what's important to people, how it's going to affect them personally. So I agree with what Melissa said. And Shanda, maybe you have some input also. Thank you.
Yeah, certainly. Excellent question. I dropped the link that Melissa mentioned to the 6 Americas out of the climate communication group at Yale. And I also added another link from Eco America, which is called Let's Talk Health and Climate, Communication Guidance for Health Professionals. And it might get exactly at the point that you're bringing up. The terrific thing about speaking about climate change and specifically health from the perspective of nurses, if somebody hadn't mentioned it on this webinar yet, is that we are the most trusted health profession in the country. And so people tend to take what we say as being valid. At least we're coming from that angle, but also bringing in your personal story and what matters to you, and opening up their opportunity to be, you know, to add what matters to them. Oftentimes that can be future generations. So one really, you know, considerable angle is their children and their grandchildren.
Legacy. Legacy is an issue that tests well among all audiences, and thinking about that. So you make a great point.
And absolutely. And we know that there's people on this call that aren't just nurses. So it's important to health professionals in general. They trust you. So you, at least you have that to go by. Hopefully they'll listen to what you're saying. Thank you.
Are there any other questions? That was a great point. Thank you so much for making that point. We have about 3 more minutes. Well, hopefully the conversation is just beginning here and not ending. I am going to share with you the post-test evaluation as a link in the chat. And I encourage you to fill that out, whether or not you want to get the 1 CE credit. We really do appreciate feedback on how we can improve this presentation, or things that you're interested in that we're missing. And also we want to make sure that we achieve the learning objectives that we outlined for today. So please go ahead and fill out that link that's in the chat. And if you are having any trouble with it, accessing it, I will go ahead and just also pop my email into the chat with Florida Clinicians for Climate Action. Go ahead, Carol, you look like you wanted to say something.
Yeah, we also encourage them, if you guys could take that survey too, there's a link to it on the last slide. It's called the Chance Survey. And it's open to health professionals in general. And it just gives us an idea, gauges the knowledge of health professionals, and helps us focus on areas that maybe we can help health professionals in general, you know, increase education. Shanda, you're familiar with it. I think you helped develop it. Do you have any comments on it also?
Just that there are not a lot of surveys out there evaluating nurses and health professionals' understanding, motivation, demotivation around climate action. And so you have the opportunity to kind of share your own experience with a pretty pretty front-running group of surveys here.
Excellent. So I reposted some of those links in the chat. And I just want to thank everyone again. I want to thank you all for joining this conversation. Like I said, you are already doing something meaningful by showing up here today and learning about this. I want to thank Caitlin and the SEIU Local for inviting us to join you and educating your members. We want to be a partner to you and continue that partnership. And I want to thank SHANDA and Healthcare Without Harm and Practice Green Health for presenting these options, and my lovely colleague Carol Lindsay, who's done so many great presentations on this. So thank you, all of you. Are there any other final comments from any of our panelists or guests?
Just really feel free to contact us. You have our emails if you need more information. We'd be happy to help you. We're very passionate about this. Personally, this is what I'm doing in my retirement. I'm very concerned about climate change and its health impacts and on our world. So thank you all so much for making the time to come to this presentation. I echo Melissa's thank you. And thanks Shanda and Caitlin. Hey, go Jackson Memorial Hospital. You guys are very proactive. This is so awesome. And Shanda, you're so knowledgeable. I learned some things today too. And Melissa, thank you also as usual. Great.
And a few people were saying they weren't able to get the links in the chat. So what I'll do is, if you're registered for this webinar, I'll send a follow-up email, and Caitlin, and I'll copy the panelists on it as well, just with the link to the survey so that you can fill out that post-test evaluation. And I want to thank everyone. Thank you, Caitlin, for inviting us to speak to your group. We have a great group of folks who are doing good work.
It's really awesome. Well, thank you guys so much for joining us. And if you haven't already, please don't forget to vote.
Oh yeah, the most important thing. We have a good point, Caitlin. It's a couple of days left, and record voting out there, and you know, everybody, your vote has power. That's the way that you influence change in this democracy, is with your vote. So your vote and your voice matter. So thank you so much. Your vote can absolutely help the environment.
Mm-hmm. Yeah. Thank you all.
All right. Thank you, everyone.
Thank you, everyone. Take
All
care.
right. Have a good evening, afternoon.
Okay.
Bye now.
You.
Thanks. Okay, I'm gonna end.